name is Timothy Pluard. I'm a breast medical oncologist and the founder and director of the St. Luke's Koontz Center for Advanced Breast Cancer in Kansas City. I'm here today to talk with you a little bit about clinical trials. Clinical trials have been a long-term passion of mine and part of the reason we started the center specifically focused on metastatic breast cancer patients and the care of them. Clinical trials are a critical component of that. And nationally, less than 5% of patients with metastatic breast cancer participate in clinical trials. But these clinical trials are really the lifeblood that leads to new therapies available for all patients with metastatic breast cancer. So our goal is really to try and improve the access to clinical trials. We know that the primary reason that most patients with metastatic breast cancer don't participate in a clinical trial is because no one asked them or discussed it with them. So we want to focus that and improve that moving forward. And in order to really reimagine how clinical trials may look moving forward, I think we have to think about several avenues to improve enrollment to clinical trials. And I generally refer to this as the democratization of clinical trials. Right now, most patients on clinical trials are at academic medical centers. Unfortunately, most patients are not at academic medical centers. We need to figure out how we can get clinical trials to the patients, to more patients. Because if we can expand the number of patients in clinical trials, we can accelerate the development of new therapies for all patients. There are some specific strategies that I think we could utilize. One is we have to really try and reduce the bureaucracy around clinical trials, which leads to long time delays in opening clinical trials and significant costs, which prohibits many institutions from being able to participate in offering clinical trials. Second, we really need to normalize the population that participates in clinical trials. Right now, there are significant limitations called exclusion criteria that eliminate patients from participating in clinical trials. So the patient population in clinical trials is really very select and not necessarily reflective of the population in general. By reducing those barriers to participation, we can increase the number and again, accelerate progress of clinical trials. And lastly, I think we need to focus on specific populations which have been historically underrepresented in clinical trials. Black patients with metastatic breast cancer have the worst outcomes of any group, and yet they are amongst the lowest number of participants in clinical trials. And that is because, again, they don't get asked to participate in clinical trials. And we need to overcome some of the historic resistance within the Black community to participate in clinical trials because of negative past experiences within that group. So in closing, if you're a patient with metastatic breast cancer, ask your doctor about participating in clinical trials. If you're a physician or a member of industry or an advocate, help the cause by making clinical trial access easier for everyone.